what Bryota is doing.
Thank you so much, Ashwin, and thank you so much all the panelists. I mean, it's not only COVID, the overall lockdown situation has created a new kind of environment for all of us. And I'm so glad while Nilofer was talking about, picking up a hobby or picking up doing something different. I'm glad that I picked up cooking. And I think that helps me calm down a bit and also helps Bryota to do whatever we are doing currently in the COVID-19 situation. So with that note, today we are launching Healthy Lungs program with our SiA health coaches. So SiA stands for Systematic Intervention Agent. And I know all the panelists talked about specific issues, especially for elderly, when it comes to adherence or following a certain plan given by the doctor. So we do believe that Bryota has the right technology and the right team of respiratory therapists, and working with our partners, some of them are in the panel today, to provide the right interventions for a healthy lung program. So what is this Healthy Lungs program from Bryota? Right. So basically, the panel also discussed about the lung health situation today and why everyone has suddenly become more conscious and cautious about lung health. Of course, COVID-19 is creating a different normal for all of us. But also in last 5 to 10 years, asthma and COPD patients have increased exponentially in India. Okay. And when it comes to lung health, it's kind of a neglected topic. I mean, everyone talks about cancer, everyone talks about cardiovascular disease, but people are not talking much about lung health, though we have a very high percentage of younger generation getting into smoking addiction. So that's a topic that we wanted to focus on. So what's our this Healthy Lungs program with SiA? It's an integrated approach. So whatever panelists are there, we have a team of various people, various partners who provide an integrated and holistic approach. And we do work in tandem with the patient, doctor, and their family as well. Our idea is to bring back the positive habit forming interventions and include all the holistic health experts at right point of time, and make sure that we use our AI first, that's the artificial intelligence first approach, which is an affordable and easy to use technology, which Bryota has built in last 3 years. Of course, we built it initially for asthma and COPD, and now we have found a strong correlation with COVID as well. And that's what our technology is being appreciated by Government of India as well. So overall, SiA coaches will work with patient and doctor and help patient improve their adherence to action plan. Okay. What it offers to patients specifically. And as I think Ken mentioned earlier, just before this webinar, I think around 3 p.m., the Ministry of Health announced that post-COVID-19, there is a management COVID-19 protocol which needs to be followed, and they are emphasizing on a holistic approach. So we have weekly coaching sessions planned with a dedicated SiA coach. We also have monthly coaching sessions with various wellness experts. It includes a psychologist, physiotherapist, yoga expert, nutritionist, and of course, respiratory technician. We have a simple mobile app to be used by elderly and children. And of course, anyone can use it, but we have a 360-point scorecard. So every day, instantly, you can check your lung health scorecard and see if you are improving or you need to do something different. We also have this connected devices. We have our own personal spirometer. It's called Spiro Pro. And we have a smart inhaler cap, which is especially useful for the asthma, COPD and fibrosis patients. So they can put this smart inhaler cap on top of the inhaler. It measures the temperature, humidity, and now because of COVID, we have added SpO2 as well to it. So what it means for the doctors, because we work closely with the doctors. So there are various measurable parameters which we provide to doctors on a real-time basis. And there's a real-time data that doctors can have access to. We also have a AI first clinical diagnosis support system. So we predict various situations in life of an asthma patient, as well as now for the COVID, as well as COPD patients. And we'll also have a team of SiA coaches working with the patients. The idea would be doctor gives the action plan to the patient, but SiA coaches actually help patient implement this particular action plan and improve their self-care and eventually help improve their quality of life. Okay. What we have is an Indo-Danish technology. So ours is a healthcare startup set up in India 3 years back. but we have been actively working in Europe. So we have a Danish entity as well. And between Denmark and Pune, we have built these two interesting devices. One on left, what you see is a personal spirometer, and you have a mobile app as well as a clinical diagnosis support system software for the doctor, and you have a smart inhaler. So that's the technology we are using in the SiA program. Okay. So finally, we at Bryota and working with our partners, we are on a mission to help you breathe better. If you have any questions regarding the SiA program or how SiA can help you or your patients, please drop us an email at sia@bryota.co. Thank you so much for giving me this time to explain